from here. So allow me to welcome every one of you, ladies and gentlemen, to this webinar, and thank you for sparing your time. And I just wanted to let you know that this session is only going to take about 1.5 hours. And we're going to have some panelists, 3 of them, that will be sharing some of the experiences with regard to the webinar, which is focusing on the role of private sector in the development of healthcare PPPs in Africa. And after that, we're going to move to questions from the participants, the audience here, and from the moderator, myself. And then we are also going to ask you to feel free to ask questions in the box that we have in the chat box there. And then we'll be able to tackle them at the end. I would like to introduce myself. My name is Audrey Mwala. I am a founder of a company called Sycamore Limited. It is a training and consulting company in Malawi. And I am a certified PPP specialist. Actually, I call myself a triple certified PPP specialist because I've got 3 certifications from the US IP3 and then the APG Global, as well as the one from the Queensland University in Australia. So I am a founder of the training and consulting company, Sycamore, but I also founded another company, which is called Sycamore Credit Limited. It's a microfinance company. I have been working in Malawi in the Public-Private Partnership Commission, and I've had the opportunity of having hands-on experience in project preparation and handling public-private partnerships in various sectors of the economy in Malawi. And I've also had the opportunity of having to travel in different parts of the world to spread the news of public-private partnerships in various topics. So both outside Africa as well as here within Africa. As you know, that the seminar here is organized by a very esteemed institution, the PPPHealth4All, where I am on the advisory board. And it is an award-winning online platform, which is designed to assist governments and private sector to develop sustainable and people-centered health care PPPs. And PPP Health4All is ambitious. It's got its ambition to actually bring all healthcare stakeholders to one platform. And we would like to encourage you to visit this platform and to join as a member. So today we'll be discussing the role of private sector in the development of healthcare PPPs in Africa. Africa has 6 out of 10 fastest growing economies, but then you agree with me that it is also has the highest disease burden in the world. The continent finds itself faced with 2 extremes, which are great expectations for the future and yet very little funding for the health sector to count on. So how can private sector support to overcome the gap in the national health infrastructure, which has been exposed largely also by COVID and the various other crises in the health sector? Spending better allows for the confidence to invest more in the sector, and seeking greater value for money along with value for people to maximize the benefits in the investment in the healthcare is central topic of our discussion I can't say this afternoon, but I should say now, because it's different times in different time zones. So allow me today to introduce our first speaker, who is Dr. Tinuola Akinbolagbe. who is the Chief Executive Officer at the Private Sector Health Alliance in Nigeria, an organization which leverages on capabilities, assets, and resources of private sector to drive improvements in Nigerian health outcomes and achieve universal health coverage. A healthcare administrator with over 2 decades of experience in the health services in terms of her qualification. And then she is also involved in the financial and ICT sectors. She has experience spanning across strategic planning, operations, and risk management, particularly in the private sector, having worked at Lagoon and St. Nicholas Hospital. She holds a degree in medicine and surgery, graduating from the College of Medicine, University of Lagos. She also has a postgraduate diploma and a master's in public health from the London School of Hygiene and Tropical Medicines, University of London. She is actively involved in mentoring students and young professionals and works with several charities and non-profits to raise funds for community health initiatives. So allow me to welcome Dr. Tinuola to the forum, that she can take the stage to take us through what she has to share with us on the role of private sector in the healthcare development. Over to you, Dr. Tinuola.
Thank you, Audrey, for the very kind introduction and for the spirited attempt to pronounce my surname. It's actually Akinbolagbe, but no worries. Nobody gets it right. No problem. Yes, well, Akinbolagbe, it's a long one. Thank you for inviting me here. I'm really glad that the PPP Health4All platform decided to have this webinar and focus on the role of the private sector in the development of healthcare PPPs in Africa. I'd like to say a warm hello to my co-panelists, Dr. Ola, who I believe is also joining on behalf of Nigeria, and Dr. Trevor Gunn. So I'd like to go directly. Hi, Ola, how are you? Go directly to my slides now, if I may share my screen. Okay, please confirm once you can see my screen. Okay. So starting, what is the role of the private sector in the development of healthcare PPPs in Africa? By way of a background, Africa, as you mentioned earlier, has a large proportion of the disease burden in the world. To be specific, most of our healthcare expenses are paid out of pocket across the continent. And you find that a number of people are just one major illness away from the poverty line. We have more than 80% of the burden of non-communicable diseases and more than 15% of the world's population and 47% of the burden of communicable diseases. Yet, despite that heavy load, we have less than 2% of the global health expenditure. So there's an obvious imbalance in our disease burden versus how much is paid for health. In the course of the next few decades, you're going to have the fourth industrial revolution, where technology and innovation will take the forefront. Our population demographics in Africa is such that we tend to have more of the younger age bracket. And so over the next few decades, we'll have that transition into older people, and who we will then see an increasing burden in non-communicable diseases, which increase with age. And so that puts a further impact on our health security. We also have a huge disparity in the types of services and the quality of services available between the rural areas, the urban and suburban areas. And so definitely there is a need for us to have public-private partnerships, which can be used to improve financing capacity and come up with innovative models and provide the relevant architecture, which is necessary for our changing socioeconomic development and be able to get the full benefits of our human capital index. And so some of the characteristics of PPPs in Africa are detailed in this slide. We have long-term contracts. For instance, in the recent partnership between the federal government of Nigeria, Ministry of Health, and Garki Hospital, that I think was like a 15-year term. You need to have long-term contracts so that most people can make their returns and the necessary health outcomes can be achieved. So really for PPPs, it's more of a marathon and not a sprint. We also have risk allocation. You must have a clear strategy for allocating risk, the ones that will be borne by the public sector and the ones that will be borne by the private sector, investors, and other key stakeholders. Then there must be well-defined performance indicators. These are metrics that will be used at periodic periods along the process to confirm or indicate whether they're on track with the set objectives. And there must be government ownership of the assets at some point. Okay. So some of the drivers of PPP in Africa, which we mentioned a few earlier on, the desire to improve the public health service, the landscape of health services that are available so that we can have higher quality services. Also for the opportunity to leverage on the private sector, the funds and the resources available in that, and then have the benefit of that in the public sector. And this is not just in healthcare, but other sectors as well. A lot of the third driver is we have a lot of countries in Africa where a large proportion of their public services are funded by international non-profit partners. And so this organization needs to be formally recognized, and arrangements such as this need to be formalized. For a lot of those organizations, they do not look for returns on their investment. They do more of impact investment, but still there must be measurable metrics to ensure that the desired objectives are achieved. PPPs have been found to be one of the ways where we can foster development and work with insufficient funds that are available. I mean, there are huge burdens on the budgets of most African countries. So the private sector can step up to take the role of financing and supporting. And then as the private sector matures, you have more potential partners, both local partners and international partners in the private health sector. So a background to PPP in Nigeria, some of the PPPs or successful PPPs, I must be honest, we've had some not so successful ones as well, but some of the successful ones that we've had, a lot of them are focused in the urban centers. We have in the Federal Medical Center in Ebute-Metta, Garki Hospital in Abuja, which I mentioned earlier, the Lagos University Teaching Hospital, IBOM Specialist Hospital, LASU, which is the Lagos State University Teaching Hospital, and also UCH Ibadan, University College Hospital in Ibadan. It's helped to define the relationship between public and private sector. And obviously we've had the effect of creating employment opportunities and the multiplier effect on the economy, and also helping to improve human capital development. The PPP model has been implemented in several sectors in Nigeria: aviation, power generation, transportation, education, and they have had varying degrees of success. but it's somewhat limited in the health sector, and it needs to become the mainstay rather than the exception. In 2005, the Nigerian government formally adopted the policy on public-private partnerships for health in order to address some of our very poor health indices. We have really poor health indices, particularly concerning maternal mortality and infant mortality ratios, and also a relatively low life expectancy when compared with similar economies in our region. So some of the contributions that PPPs could make to the achievement of universal healthcare access could be more discrete improvements in service or broad interventions at a strategic level. So from the technical expertise point of view, in Africa, we have the USAID Uganda Private Health Support Program. This has been used as a way to operationalize and implement the policy, the PPH policy, and put it into action. It also helps in the form of innovative financing. So when we look at Nigeria, for instance, we have the COVID Coalition Against COVID-19, which was spearheaded by Alhaji Aliko Dangote, Mr. Aigimokwede, Mr. Jim Ovia, Herbert Wigwe, and other private sector leaders. And they were able to raise over 30 billion naira to support the Nigerian government. And this was almost entirely from the private sector. I mean, it was the first of its kind in Africa and in Nigeria specifically. And I do think there's a lot of room to improve on that and replicate that in other areas of healthcare. Supply chain and logistics. The African Medical Supply Platform, at about the same time as the COVID initiative, this was spearheaded by the African Union, and you had Strive Masiwa and also other private sector players such as Novartis, COVAX, and the Rockefeller Foundation work on this. They worked on consumables and logistics to support the fight against the COVID pandemic. And then we have areas like healthcare delivery. So PSHAN, which is the Private Sector Health Alliance of Nigeria, is taking the lead on what we call the Adopt a Healthcare Facility Program, where we're looking to deliver one global standard primary healthcare center in each of the local government areas of Nigeria. This is private sector funded, but leaning on the aegis of the National Primary Healthcare Development Agency, which is a government institution, and it's a good example of PPP. Also, we have the Nkosi Albert Luthuli Central Hospital in Durban in South Africa, which is also, it's a referral hospital, and it's a partnership between the private and the public sector. So some of the challenges are quite obvious. Limited funds. We have, number one, an inadequate legal and regulatory framework. This needs to be well developed so that it's practically plug and play, I'd say, quite straightforward. But when we have PPPs and you have to reinvent the wheel each time, it makes it difficult. So there should be a concerted effort to have better legal and regulatory frameworks in place. And this should be driven by the public sector, by the government, because they stand to benefit the most. Secondly, we have a rather limited financial market, both in terms of capacity, actual funds available, and then the market size is small and quite fragmented. So we need to increase our global trade and investments and access to funding, you know. Also, there's a lack of technical skills to be able to manage this types of PPP programs and projects. In the healthcare sector particularly, we've seen a lot of brain drain, both in the actual delivery of healthcare services and even in more technical areas like this. And then also the unfavorable environment in a lot of countries. So for investors to come in, you need to have a perception of a stable economy. You need to have a stable population, no incidents of civil unrest or terrorism and things like that. And there also needs to be a lot of policy stability on the part of the government. And so that helps with risk assessment when investors do decide to come into such a country. So the future of PPPs in Africa. There are areas for large-scale investment. We can look at some of the issues that trouble us in Africa. I mean, we mentioned earlier on about the market being small and fragmented. That's not entirely true. A lot of the healthcare market is actually lost, and it runs into, at least for Nigeria, it runs into billions of dollars on an annual basis. And so if that market is available, I mean, then there will be a sizable market where investors can look to recoup some of their investments. So the medical tourism does drain a significant proportion of cash flow. And in countries like Nigeria, it also puts a strain on our forex availability. So we need to encourage capital investments and infrastructure upgrades. And the government needs to commit to healthcare transformation. We are looking at having some types of health villages where we can pool resources and expertise. The Lagos state government is looking at having a medical park called Medipark. It's estimated it would cost about 49 billion naira and will be able to offer a compendium of high quality, technologically cutting edge medical and diagnostic services. Another area is if we are able to improve the regulatory landscape. As we mentioned earlier, the government must proactively ensure that there are policies in place to aid the ease of doing business, particularly health business. We said earlier, health business is not a sprint, it's a marathon. But if handled properly, like any other business, there is room for investment and for good returns. We can look to providing some types of tax incentives and tax reliefs, and something as simple as just amending some of the company income tax laws that we have, and then encourage philanthropic endeavors into healthcare by the private sector. We need to better regulate our systems to reduce brain drain and also have a better maintenance culture. These are all things that can be done to encourage the private sector to invest in healthcare and in PPPs. Sustainable funding. We must position the private sector to be able to raise funds, receive foreign direct investments, and then invest those in PPPs. A lot of healthcare initiatives do require investments in infrastructure. And so if we have a stable economy and we have a welcoming environment and we have legislation in place, then we can accelerate FDIs to that sector. Also, when you have the tone of the government, the stance of the government, where they match funds. I mean, you have the Abuja Declaration of 2001, which was by African Union countries to have a minimum of 15% of the budgetary allocation be to health. I don't know any country that has managed to achieve that in over 20 years. A few countries are at about 12%, but Nigeria is firmly at about 5%. So those are areas that we need to focus on. Also, we cannot continue to have the proportion of our healthcare that is funded by international aid. In some countries, this is as high as 40 to 50%, whilst in, I think, Nigeria, we're probably hovering around 10%. So we must be able to mobilize domestic source of funding in order to invest in healthcare. A major issue that we have is trust. There's been a lack of trust or a loss of trust in the public sector by the private sector because of previous flip-flops that we've had in policies, from the government and in changes. There's nobody interested in investing their money and losing it all due to flip-flops by the government. So the public sector must make a concerted effort to improve trust by the private sector and adopting a collaborative and transparent approach, and then build on the lessons that we've learned from PPPs that have been successful in aviation, in energy, in transportation. The instances where Chevron Nigeria has partnered with the NNPC with a JV and been quite successful in exploration and production of oil and gas resources. Also in Lagos State, we've had the government procure buses, which are run and managed by private logistics firms under the Lagos ERT.
Just mind the time. Can I just ask you to be winding up?
Thank you. I'm actually winding down. So this is my last slide. So our call to action is, in order to go faster, health businesses must align with increased sources of funding and work with venture capitalists. I'm sure Dr. Ola will say a lot more about that. And then telecom companies, people in oil and gas, and look to other sources of capital. African governments must strive for transparency and accountability in the use of resources deployed. Health is wealth, and for us to be able to unlock the full potential of our human capital and improve the wealth potential in the health sector, we do have to focus on PPPs and get the political will to make this happen. Thank you so much for listening.
Thank you very much. That was very, very insightful, and we really appreciate the presentation that you've made. And because we are trying to catch on time, we're going to take all the questions at the end. So you have to bear with me because I'll be rushing to go to the next speaker. And then from there, we'll go to take the questions for everybody at the end. But we really appreciate your presentation. Allow me to introduce the next speaker, who is Dr. Trevor Gunn. He's a Vice President of International Relations for Medtronic, the world's largest medical technology company based in the USA and operating globally. Dr. Gunn was formerly a long-term director of the Commerce Department Business Information System Services for the newly independent states. During his long and successful career path, he has worked with many governments and non-governmental institutions. He is the founder and chairman of the USA Health Alliance. He also sits in the US State Department Stakeholder Advisory Board on the OECD guidelines and on corporate social responsibility. Dr. Gunn chairs the International Affairs Committee at MedTech Europe, Europe's largest medical technology trade association. Further, he is a board member of a multiple domestic and international organization, has served for the past 28 years and currently serves as an adjunct professor at the several programs in the business diplomacy at the School of Foreign Service and Georgetown University. Finally, he serves on the advisory board of the University of Minnesota Carson Business School. So allow me to welcome Dr. Trevor and ask you to go on with the presentation, and I would request you to just observe the 15 minutes, and then afterwards we'll be coming back to you with questions. Over to you, Dr. Trevor.
Thank you so much, Audrey, and it's great to be with our African sisters here to talk about opportunities and PPPs in Africa. And good morning from Washington, D.C. to everyone. I'm sorry, I've got a strange thing going on with my screen and I can't put it in presenter mode. I've got too many screens. So my apologies. I hope you can see it okay.
Yes, we are able to see.
Okay, thanks for that. Thank you, Audrey, again. And as you said, Just a quick summative slide on who we are. You know, for many years, Africa has been quite distant for Medtronic, very focused on maybe 2 or 3 different countries. You can imagine who those are, but I think change is afoot, and we're much more interested in many more countries in Africa. And thus, if we don't know Africa, probably many people don't know us. So, you know, this is a mutual get-to-know relationship here. So these are some statistics about us, but I want you to look at the bottom right. This is a PowerPoint slide that we use on our team. My colleagues, Shireen Yassin is with us today. Mark Halliday, our Global PPP Director as well, on the line. And around the Q&A, we might have some interventions from them. I can just point to that fact that PPPs is very much a part of how we present the company to the outside world. This is not modified for purposes of the presentation here on Africa, but there we are. So this is the slide to confuse absolutely everybody, to make 100% sure that that you understand. However, the extent of our interventions, we make a tremendous amount of technology, I think, as some of you may know. But you know, our fundamental issue is getting access to that technology and making sure that that high technology gets contextualized, particularly in an African environment, which I would say is the definition of success. If we can get some of the fantastic technologies that we have in some markets in the world involved and being in proper use in the African public healthcare systems, we are really doing our job. So access is very, very important to us. We figured you would probably want to know a little bit more about, you know, what our footprint is on the continent, and of course you don't need me to tell you that you have 55 countries, but we actually have divided into 2 sub-regions, as you can see: emerging Africa and Southern Africa. Our Africa headquarters is in Cairo, but we have, you know, extremely strong leadership teams in Ghana, in Kenya, obviously South Africa, and a few other places. Of course, you know, beyond that, of course, we have an extensive distribution network across Africa. Right. Specifically around PPPs, thinking about some of the push-pull factors, and I totally agree with Dr. Tina here about, I mean, virtually
just to
identical.
check, are you changing your slides? Are you changing your slides?
I am, yeah. I'm on slide 5. You can't see that. Is that right?
Yeah.
So I apologize. I've been going through about 4 slides. Didn't hear any. So my apologies. Let's see here. Maybe I can do a new share and I can somehow, let's just see here. Are you able to see that? Are you able to see the title,
yes,
Demand
yes,
for
yes.
Modern PPPs? My apologies. Just so quickly here. So maybe just go back. This is the slide I mentioned about our profile. It's a busy slide. We'll be happy to share the slide deck. This is a slide around all the different disease conditions that our technologies treat. And by the way, we're the inventor of the pacemaker. That's the original pacemaker right there in the individual's hand. And then I had this slide, Audrey, here around our Africa footprint. I do want to actually point out one thing I didn't mention before, which is we have a very large training and education facility in South Africa, where we have a lot of doctors from around different parts of Africa, not just Southern Africa, coming there. Good. Thank you for saying that, Audrey. I'm sorry about that. So I was just talking about the demand for modern, what we call modern PPPs, as opposed to maybe sort of traditional PPPs. I consider, you know, traditional PPPs to be ones that are more or less cookie cutter PPPs. And these are not undeserving. They have played an important role and will continue to play a very, very important role, which is particularly around imaging and renal dialysis. These are where governments seem to be very, very well prepared. They're templates. There's ways of looking at them in ways that are excellent. However, when we talk about modern PPPs, we're talking, and I'll explain what I mean in a moment about that. We're talking about a whole different level of PPP, and we're talking about potentially drawing on different skill sets and different frameworks than otherwise. And right to Dr. Tina's point here about aging populations around the world. We're thinking chronic disease density burden. And I mean, I don't need to tell you how taxed Africa is alongside C19 and other infectious disease burden. But, you know, in a country like Ghana, you're talking about the hypertension burden being upwards of amongst the highest in the world, well over 60%, alongside, of course, diseases that everyone knows well. There's a massive skills gap. And I think one of the big points about the medical technology industry is, and we don't tell the story very well, frankly, but the point is the work is being done, is training and education, how much training and education we do. And I would just say this, is that we're training, even as one company, 13 times more people, doctors, physicians, tertiary healthcare surgeons, et cetera, now, 13 times more than we did 2.5 years ago before the onset of COVID. Much of that is virtual because of the necessities. We obviously know that healthcare, to your point, Dr. Tina, that you mean 15%, the Abuja Declaration, we know it quite well. You know, this is, it remains sort of a planet that you can kind of see here from Earth, but it's sometimes difficult to get to that planet, and I completely agree with you. But we also know that there are fiscal strains, and we obviously need to bring that on board. Focus on infrastructure alone, and this is what I mean by traditional PPPs. When people think about success, they're generally talking about building a brand new spanking facility. If I was a government official, I was good in government for many years, I would say, hey, that's the definition of success. It's a brand new spanking facility that I can show in the media. I like that just like any other person likes that. Let's be honest. But is that really always the best definition of success? We want to make sure that PPPs are much more focused on outcomes, not just volume, but literally value. And getting those patients into healthcare systems at an earlier stage. COVID pandemic, I don't need to tell you more about that. And then, of course, we hear, not only because of COVID-19, we hear a lot of demands on us and many other countries for more research and development and manufacturing on the continent, of course, in other countries. We think about PPPs in Medtronic in 4 lanes. Clinical training and education, I've talked to you about, and we're actually bringing a couple examples. Health system strengthening is very important because it's like taking a problem, maybe a disease state, could be diabetes, could be hypertension, could be, you know, could be something in the neuroscience area because of so many, you know, road traffic deaths, as an example. Whatever that problem is defined by the government, and really building a team around it. Sometimes Medtronic will sit at the top table. Sometimes we'll sit as a partner. Sometimes we'll sit under the table. But we're always, that is Medtronic, as a servant of the public healthcare system. We're serving the needs of the people, and whatever proper role we can play to solve that particular problem, that is our role. Not to dictate the terms, but to serve that particular public healthcare purpose. Manufacturing for market access. This could come in research and development. It also a little bit, but it's sort of the next 2 categories sort of straddle, right? So you know, in order to get more research and development and more manufacturing into the continent and many other countries, you know, we believe that putting it on a PPP framework, meaning a much more long-term strategic relationship, is going to get more for both sides. We firmly believe in the promise of Africa, and African science and medical doctors are second to none anywhere else in the world. But we firmly believe also that those innovations need some encouragement. Sometimes they need to partner with companies like us to distribute those great technologies and those great innovations on a global basis. Whatever the needs are, we're ready to do. All right, a couple case studies very quickly. Both of these case studies actually will be in Eastern Africa, if you don't mind, but around training and education. So everybody that's involved understands, in medicine, understand that sort of traditional surgery versus what we call minimally invasive surgery. It's a massive leap between the two, but there are also really radical benefits for the public healthcare system. So we did a partnership in Rwanda that's active right now, implemented in 2 particular hospitals, whereby we built a sustainable training model, training African surgeons around MIS skills there. We place some of our equipment within the hospitals, and those are sort of ongoing. I don't want to crowd out the question and answer, so I'll move to the next and final example. Kenya. So I am kind of calling up here that this is a traditional PPP. This is not what we'd consider to be, in our definition, a fully modern PPP, but still very, very viable. So, you know, our colleagues in Nairobi, a visionary distributor, a partner that we have there for many, many years, really was kind of the lead in this particular one where we served alongside her. You know, we trained, built infrastructure and trained technicians in 47 counties in Kenya. And you see how much we've actually installed in the as a result of this particular private-public partnership. So I hope that you come away with the thought that Medtronic is real. We're thinking a lot about the continent. We are thinking in both traditional PPPs, but we're also extremely interested in doing what we consider to be modern PPPs, which are, again, disease-centric, much more focused on results at the end of the day, which are generally healthcare outcomes. And I will, Audrey, leave it back to you. And thank you for your attention.
Thank you very much, Dr. Trevor. That was very insightful, and we appreciate. And in the interest of time, I will not comment much and move to the next presenter so that we can have that, and then we'll have questions. Allow me to introduce Dr. Mwala Brown, a founder of Flying Doctors Healthcare Investment Company, which specializes in technology-enabled healthcare-focused public-private partnerships in Africa. The company deals with infrastructure investments along with fintech and health tech investments. Dr. Mwala studied medicine and surgery at the York Medical School, after which she worked in acute medicine in the UK. She then went on to be awarded the Japanese MEC scholarship, which allows her to further her studies in Tokyo, Japan. She also holds a master's degree in finance and economic policy from the University of London. Her postgraduate areas of study include finance, pre-hospital emergency care, healthcare leadership, healthcare delivery, and economics. She is a certified PPP specialist, a project finance and accounting professional from several prominent institutions. She currently teaches economics and finance at the School of Politics, Policy and Government in Nigeria. Allow me to welcome Dr. Mwala Brown to the table. Please, it's your time.
Thank you very much. And it's been listening to all the speakers. It's been fascinating so far. I'm going to sort of continue on a similar vein, talking about some of our experiences in the PPP sector, as well as how technology kind of intertwines with infrastructure. So this was an about me slide, but I think Audrey has done such a great job of introducing me. I started my career as a medical doctor, working on the wards in the NHS, and then went on to do medical research in Japan, where I was selected for the MEC scholarship. I've published 4 textbooks, 3 in clinical medicine, 1 in economics and finance. I've been investing, I'm working full-time in finance for almost a decade now, working in venture capital and infrastructure finance. My master's is in finance and economic policy from the University of London. I'm also on the Healthcare as a Private Business committee for the Nigerian Economic Summit Group. And I'll be talking a lot more about this journey from a business operator, because when I first moved to Nigeria, I started in emergency services and medical services business, to where I am now, as well as some of the learnings that we've had from the public-private partnerships that we've executed. So I'm going to start by talking about healthcare in Africa. We all know the statistics, so I won't dwell on that. But why healthcare in Africa is actually so bad is something that's a bit more nuanced, and I'll probably spend a bit more time on that. Then I'll talk about public-private partnerships and their challenges in general, before going on to talk about some of our track record and completed public-private partnership projects. So healthcare in Africa, as we all know, and everybody has pointed out, is not just bad, it's actually extremely bad. So the IFC in their paper on healthcare said that Africa overwhelmingly has the worst healthcare outcomes in the world. So healthcare challenge everywhere. If you are in American election season is coming up right after ours, and one of the biggest topics in the most developed, some people would say, country in the world, but definitely the most powerful economically, is healthcare. So it's still a challenge for America, it's still a challenge in Asia, it's still a challenge in Europe. It's just that Africa has done uniquely badly in terms of being able to solve this challenge. And we know all the statistics. But why is healthcare so bad in Africa? Even though we know that everybody has healthcare challenges, why is Africa so uniquely bad? And the easy and simple answer would be poverty, right? Africa is the poorest continent in the world, as well as, so it would follow, I guess, that Africa has the worst healthcare. So just for comparative analysis, the economy of California, which is one of the largest states in America, is larger than the whole of Africa. So if you combined all 54 countries in Africa together, the economies of all 54 countries, you'd still get an economy smaller than the economy of California. So the easy answer, I guess, is poverty. The much more nuanced perspective is there are countries in the world, like Thailand, like Costa Rica, that have similar GDP per capita as many African countries, and still manage to get much better healthcare outcomes. And as Dr. Trevor Gunn probably knows, the American on the call, that large amounts of healthcare spending don't necessarily always equate or don't have a directly proportional relationship to healthcare outcomes. And even if you look in the Western world, for example, the US spends over $10,000 per person on healthcare. Norway spends $7,000 per person on healthcare. The UK spends $4,000 per person on healthcare. And all of those countries have roughly similar outcomes. In fact, some might say that the countries that spend less, like the UK that spends about $4,000, delivers healthcare to more people in a more efficient way than the American healthcare system that spends more than double. So we know it's not just about money, but definitely money is a major factor why the African healthcare system underperforms. And there's really a need to do more with less. But first of all, who pays for healthcare? How do we get an efficient healthcare system, and what does that really mean? Well, there's three main ways across the world that people pay for healthcare. In the UK and most of Europe, the government pays for healthcare. It's free at the point of delivery. And, the government pays for healthcare via tax income. In America, there's a mixed picture where the government has some responsibility, but there is also a lot of private insurance that pays for healthcare. In most of Africa, it's still out of pocket, where people are paying out of their tiny earnings and having to take out of their earnings for healthcare. And we know that that isn't sustainable. In America, employment and healthcare provision have a very close relationship. So most of it isn't people paying for insurance. It's actually people in the formal employed sector, and Dr. Trevor will correct me if I'm wrong, that have health insurance attached to their jobs, which means if they lose their jobs, then they lose their healthcare. So when we're looking at models to copy, that might be something that we want to avoid, having healthcare attached to formal employment. And why is that important for Africa and not as important for America? It's important for Africa because most people in Africa still work in the informal sector. They don't have formal jobs that have benefits. They work in the markets, they work in their farms, they're independently and informally employed. Most of them don't have bank accounts. So if we're designing an employment-based insurance cover scheme, then we would probably not be as successful as America in implementing that in Africa. So we have three options. We've taken out of pocket. We know that that's not sustainable. sustainable. It doesn't work anywhere in the world. And we're left with the insurance and government tax income. Now, why can't the government just pay for all healthcare for every single Nigerian? Why can't the government in Kenya pay for every single Kenyan? Why can't the government in Ethiopia or Sudan or Gabon pay like the NHS pays? That's a very interesting question and something that I've addressed in previous talks. I mean, Dinara, for example, you're in Germany, and the government pays for most healthcare in Germany. The same with Sweden, the same with Finland. So why doesn't that happen in Africa? So I'll speak to Nigeria, using Nigeria as a case study, because it's a pretty interesting answer. The government gets money from tax. And in the UK, the tax to GDP, that's a total amount that the country makes, is about 35%. So 35% of all the money that the country makes can be collected in tax. That's a lot of money. In some countries, it's up to 40% of all the company money that the country makes can be collected in tax and then put to social services like healthcare and education. In some African countries, it's as high as 15%, which is less than half of an already much smaller amount that is collected in tax. In Afghanistan, at the time that they were at war with the most powerful country on the face of the earth, they collected 9% of GDP in tax. Nigeria collected only 6% of GDP in tax. And that's not enough to fund anything. So it would be very, very difficult for Nigeria right now to be able to do what the UK does. And just to put the UK's spending on free healthcare for everybody into context, the budget for healthcare is about $200 billion. $200 billion per year. And that $200 billion per year takes care of their population of about 60 million population, or 60 million citizens. The Nigerian federal government budget, which is not including the state budgets, just the federal government budget, is about $1 billion. And that has to cover the healthcare needs of 200 million people. So while the UK is budgeting $4,000 on healthcare, Nigeria from the federal budget is budgeting $6 per person. And there's a huge difference in what you can do with $4,000 compared to what you can do with $6,000. So we've kind of spoken about out of pocket, and we've said that that's not viable because people are poor in Africa. And we've spoken about government taxes and levies. And that's not really viable unless we find another source of income. And we've spoken about insurance. And I think insurance is interesting because even though I would say, and again, Dr. Trevor can speak to this, I would say probably America is the most capitalist country in the world in terms of the ideals of capitalism, spreading capitalism to the world, the most successful economy. But even in a country that believes in capitalism and believes in the power of the private markets and has leveraged the private markets to create one of the most successful countries on earth, 1 in 3 people are still require, 1 in 3 people still require some form of government payments for their healthcare. And there are a lot of politicians in America that think that the government should be paying for everybody's healthcare. And it becomes a very contentious issue every election cycle. Now, I'm not going to give the answer for Africa, but I want to contextualize this so we understand the problem and how PPPs are possibly the most essential part of the solution to this problem. But just before I go on to the part of the talk about PPPs, I would like to further contextualize Nigeria and most of Africa in terms of earnings and in terms of the possibility for these out-of-pocket payments. So like I said, here's Nigeria by earnings, 203, I think it is, million people. Only 12,000 of those people are dollar millionaires. Now you compare that to a state like New York, where 1 in 4 people are dollar millionaires, compared to 1 in several thousand. And you can see that, you know, the population of people that have a lot of money is very small. Now, most people take the definition of middle class, at least in the emerging markets, to be over $9,000. So if you earn over $9,000, you can pay for insurance, you have enough money to eat, you are a member of the middle class, as far, not in America. In America, I think the poverty line is around $21,000 per year. But in most developing markets, it's around $9,000. In the $9,000 and above bracket, we have 2 million people. This is probably a number of people that can pay for a reasonable healthcare, health insurance package priced at the market price. Just beneath them, we have people that earn between $4,500 and $9,000 yearly, and these are the skilled aspirational class, and they are taken. But most Nigerians are either survivors, where 80 to 90% of their income is spent on food, and if they have the option to buy anything else, they'll buy more food, and the ultra poor that earn below $1,000 a year, that don't even have enough money to feed themselves. So they are not going to buy insurance, and they can't afford to pay out of pocket. Now, if you contrast that with India, they have 1 million millionaires. If you're looking at the upper middle class in India, the class that earn $9,000 and above, they have 100 million people earning $9,000 and above. So it's a very, very different market size when you're starting a healthcare business in India compared to when you're starting a healthcare business in sub-Saharan Africa. And if you want more context on this, I'm happy to provide that. I have a video lecture, probably about an hour video lecture, just on this subject of market size and how to target particular markets with different products for healthcare. But now to the PPP part. Okay, one more thing before the PPP part. It's around medical tourism and what medical. My honeymoon was actually here in America. I went on a cruise from California. And when I was in the Uber, I made the mistake. I usually call myself an investment banker, and that way people don't start telling me about their medical problems. But because I trained as a doctor, sometimes the word doctor comes out. So the Uber driver was like, oh, what do you do? And I said, oh, I'm a doctor. And then I knew I'd made a mistake, because there I was on my romantic honeymoon, and he starts telling me about his knee problem. But I got intrigued when I realized that he had to get treated in Mexico for his knee, despite the fact that Stanford Medical Center in California had just spent $1 billion on like a state-of-the-art orthopedic center. So I asked, why on earth would you go to Mexico for treatment? Like, it's dangerous. Like, I just don't understand. And he said that he, as an Uber driver, have employment-linked insurance because of the way that Uber works. You're an independent contractor, and what he earns from Uber wouldn't be enough to pay health insurance. And I said, no, that can't be true. So I looked up the price of health insurance on Google, and then we calculated how much he earned from Uber. And actually, he would have been spending 80% of his total earnings on health insurance if he had health insurance. And the same thing applies in Nigeria, where we have a tiny middle class. I mean, only 1 million individual travelers leave the country every year out of 200 billion. So there are not that many people flying anyway. The numbers for medical tourism are probably around 20,000 or 30,000. So it's a tiny, ultra-rich elite. Most people haven't even collected their passport, talk less of leaving the country. And sometimes we forget about that fact when we talk about medical tourism and the huge potential there is for medical tourism. One of the people that works in our house, our gate man, I forgot my passport. So I was at the airport trying to check in, and I just realized that my passport was by my bedside. So I asked one of the gentlemen that works in our security to get my passport. are you? Where are you? He's like, oh yeah, I'm 5 minutes away. So I was there, Turkish Airlines, are you still going to check me? And the Turkish Airlines guy was like, yes, as long as he comes in 5 minutes, you still have time. So I was going full panic. He came in and he said, here's your passport. And what he bought was a passport photograph of me. And I said, no, I need my document, I'm traveling. And he had no idea that there was a booklet that you use to leave the country. That is the average Nigerian. That is 90% of the population. And if we keep on talking about this money that has missed and money in medical tourism, then we forget about 90% of the population that don't even know what a passport is, talk less of leaving the country.
I will ask you to wind up.
And back to my Uber honeymoon story. It's possible to have state-of-the-art facilities in every single state and have a huge proportion of the population that simply can't afford them. So how do public-private partnerships help? They transfer risk between the public sector and the private sector, meaning that the private sector has lots of capital, and with the right structures, we can bring that capital into the public sector. So we started from the beginning. Remember when I said that African governments are poor, they don't have enough money. So public-private partnerships are the perfect solution for these poorer African countries, where we can bring long-term patient capital into the public sector to solve problems in a more efficient way. And I was going to talk about the spectrum of public-private partnerships, but I'll probably come back to that in the defensive, transformative, the market opportunity, you know, all of the stuff. But what I'm going to dwell on and conclude on is some of the challenges. This is not a problem of funds. I can raise money like that. People want to put money into healthcare, but the structure to enable those investments is lacking in most of Africa. And also, when private-public partnerships are executed, they're executed in a copy and paste way. So taking the exact same cost structure from places like the NHS, from places like the Mayo Clinic or the Cleveland Clinic, and dumping them into Africa where we know that they can't afford them, instead of incorporating technology in a thoughtful way to be able to do more with less. And just to talk a bit about what we've achieved, just by the numbers, because we don't have very much time. I was going to speak about some of our track record, but I'll just finish here on some of the things that we've been able to do. So we've done public-private partnerships in some way, shape or form in over 12 states in Nigeria. And we've started moving outside Nigeria now. We have a pipeline of $200 billion of projects. We have one MOU signed in an African country outside Nigeria, so that's very exciting for us. And the hospital that we're collaborating on is 70% completed in that country. So we felt that, you know, we'd done a lot of work in Nigeria, and in our push to become a Pan-African PPP company, we wanted to make sure that we could do things in other areas of Africa as well. And we're super excited to be able to progress and make progress in other areas of Africa as well. In terms of our technology investments, we've made almost 20 investments in healthcare technology, in fact, healthcare and fintech, over 3 funds. We're currently raising our 4th fund. And our sectors are biotech, diagnostics, logistics, telemedicine, EMR, other forms of software. And those investments have done extraordinarily well. So we know that there's potential. And we know that technology works very, very well with infrastructure. So we call our projects technology-enabled infrastructure projects, where we use technology to make those projects more efficient. So it's not a copy and paste model. Our projects, our infrastructure projects, actually have lower cost and more efficiency than the American and the European models. So in summary, I think that, you know, understanding the problem is key, understanding the numbers is key, understanding the data is key. Companies with a strong track record like ours exist, and the funding isn't a problem. We can raise the funds. The problem is the structures to enable us to execute PPPs in a fast and efficient and cost-effective manner. And I think that as we go through the Q&A, it would be really interesting to explore more deeply about some of the collaborations that have made our projects happen, and how essential it is for Africa to be able to embrace public-private partnerships in healthcare, not just because it will improve healthcare, but because we know also that the NHS, for instance, is the 6th biggest employer in the entire world. And what's our biggest problem in Africa? It's unemployment. We have one of the youngest continents in the world. And yet young people without work tend to do naughty things. So if we can get more money into healthcare and make progress in filling up that $66 billion gap that exists in healthcare infrastructure, then we improve the economy, improve security, and create a lot of jobs too. Thank you.
Thank you very much for that insightful presentation. We are really getting a lot of insights from all the 3 speakers, and you've brought in another angle of us understanding the issues of public-private partnerships with regard to understanding the market and the constraints and the challenges that are there. And it's really, really exciting. And allow me to get straight to the Q&A session, where we have just about 15 minutes, then we'll be concluding. I will start to ask a question where all of you can respond as speakers. In your view, what are the challenges when it comes to partner with the government in Africa, and how could it be improved? Maybe you can start, Dr. Ola.
Yes, so I think that Dr. Tinuola made a point around the right regulatory structures. And I think it's not just the right regulatory structures in terms of taking perhaps what exists in the UK or taking what exists in America and transferring it to Africa. I think our structures and regulations and processes need to be a lot more aggressive because these guys are already rich and they're already developed. So I was in Dubai with the stock exchange at a program last week, and the amount of thought and aggression that went into creating, like I didn't quite realize until I started meeting with government officials, the amount of thought and aggression that went into creating even the government officials that were in these posts. Some of them knew right from when they were going to school that they were being trained for a certain post. So I think that it's around the regulatory structure and processes, but also around the level of aggression and the level of energy that goes into making these processes more transparent, faster, more efficient than what already exists in the West. It can't be a copy and it has to be better.
Thank you very much. And I will ask the, I don't know if, but I think in the interest of time, maybe you can just comment so that the other presenter can comment on the next one. So over to you, Trevor. How can we get closer in addressing the Sustainable Development Goals agenda when it comes to the healthcare? You can respond, or if not, any of the presenters, Tinuola, you can also present. You can also respond on the same.
I'm very happy to do that. And thanks, Dr. Mwala, by the way, for all your great presentation, Dr. Tina. Fantastic stuff. But 2 things just on the previous question, Audrey. Just what we find is just the lack of legal infrastructure that's specific to PPPs in healthcare, right? As opposed to dams, roads, traditional infrastructure, right? It's, healthcare infrastructure is a different thing, and we need to think in that. But also just the human capacity. We need professionals, PPP units, right? People that are literally living and breathing this stuff, that understand all these details. I'll give you an example. In Kenya, you have a very strong PPP unit in the Ministry of Finance. Now, you can disagree or agree with me, that's okay. But at the end of the day, the people that are there are visionary, they're competent, they know what international best practice is. They can then tweak that. I think to your point, Dr. Ola, on the issue, tweaking those or you know, for an African context. However, that's fine. But I think it's the human capacity here is so important that we have trained professionals that live and breathe this stuff. UHC, I mean, you know, it's something that we live and breathe on. In fact, our CEO was the only public-private sector speaker when the UHC, Universal Healthcare, came to the United Nations. Our former CEO was born in Bangladesh, understands poverty, understands many things, and so we focused certainly around PPPs. We also focused around, and particularly ones that are inspired by value-based healthcare. At the end of the day, the fact that we're still paying for volume after all these years, I mean, nobody else in the world pays for anything else, privately or publicly, in any other way than the healthcare sector makes absolutely no sense. We should be obviously paying for results, and that's what it is. So I mean, to get to SDG goal 17, or even the sub goal like to non-communicable diseases, which are kind of our home base, 3.4 around non-communicable diseases. You know, that takes a family. For that to be successful, we need strong governments. We need governments that are very sure of themselves. The most difficult thing is when you have a weak government that feels that it's being taken advantage of. The best situation for us is having a very strong government with very strong competency, a strong legal basis. And we can then get to negotiation, and we can get to yes, no, or maybe much more quickly. Audrey, the reality of the problem is that these negotiations could just take so long, we lose interest. It has nothing to do with Africa, it has nothing to do with goodwill. It has to do with just strength of the our negotiating counterpart. And by the way, sometimes we're weak. Let's be honest, we're sometimes weak in those negotiations, and we have to look in the mirror also around that. But we really want African decision makers, African governments to pound their fists on the table, to say what they want, say what they've experienced, maybe some indignities in the past, and what is correct for them going forward. We're very interested in that. So those are just some ideas from my side, Audrey. Yeah.
Thank you very much, Dr. Trevor, for that. And I will go to Dr. Tinuola with regard to a question on PPP models, especially in the healthcare. PPP is a complicated process. Are the local players in the market and government prepared and well informed about the PPPs?
Yes, I don't think so. I think the short answer to that is no. I listened with great interest to both Trevor and Dr. Ola's presentation. So to put it in terms that the average layman can understand, if you say you're playing a ball game where a ball is involved, there's some basic rules, you understand? So if we compare the frameworks that should be in place, it would be like the rules of a game. So going into PPPs in Africa is a bit like playing in a game where there are no rules. You don't know, it's after you score a goal and they say, no, that's not the goalpost. Or you score a goal with your feet and they say, no, it's volleyball, you're supposed to use your hands. That's as simply as it comes. So we need to have frameworks in place. These frameworks can then be customized, as Dr. Ola has emphasized. You know, it's not a one-size-fits-all, but there should be some basic structure at the core, which you can then build on and customize or tweak accordingly to the environment. I think she also mentioned, which I agree with, that the problem is not just funds, although that's an issue, but prioritization and allocation of these resources. You have other countries that are in a similar economic status as some African countries, and they do have better health systems in place. That is because their funds are better allocated or better prioritized. So I think there needs to be long-term planning. It needs to be systematic on the part of the government, and they need to focus on areas that affect the critical mass, areas like primary healthcare. So those are some of the areas that I think that we can have changes from the government, and we can see some sustained improvement. Thank you.
Thank you very much. In the interest of time, I will just look at 2 questions and then we can close, because we've gone past the time that we should have been on this webinar. There's a question for Dr. Brown. Is there a role for global health and other government organizations to bolster the infrastructure for PPPs? Something like financial platform similar to GoData, the open source surveillance platform provided by Gunn. Dr. Brown?
Yes. So I was just reading the question again to make sure I understood. So I think is there a role for global health and governance organizations to bolster the infrastructure for PPPs? I think that there's a role for anybody in the healthcare ecosystem right now. The public sector obviously has to provide the enabling environment. The private sector mainly is around cash and expertise, but there's a lot of data missing in Africa in terms of how these projects can be executed. I think that there's also a lot of experts that we need to leverage on. So sometimes we work with 20, 30 consultants in public health, in non-governmental organizations, people that have been on the field in the most remote areas for decades doing this kind of work, to leverage on their experience, to gather data, to involve them in the process of evolving some of our projects to make sure that they're absolutely the best fit. And we're making those decisions. And I think one of the problems, all the failed PPPs that I've sort of studied that have taken place in Africa, they've not been data-driven. They've been maybe ego-driven, maybe they've been sort of, yes, grand vision-driven, but they've not been backed by the numbers. And as you can tell, I'm a very data-driven person. If there's no data to support it, then it's very, very difficult for me to execute. And I think that that's where these global health experts can come in, that's where the nonprofit sector can come in, and really that can be used to really make sure that our projects are fit for purpose.
Thank you very much for that. And indeed, data is very, very important. So we're going to go to Dr. Ola. I think there's a comment okay, maybe let me skip the comments so that I can focus on the questions since we are running out of time. So I'm going to take this for Dr. Trevor. What is the government policy on reusage? What is the government policy on usage of refurbished machines? How the payment risk is mitigated? You can also be free to just check on the chat, and then who bear the medicological cases in the PPP arrangement, and are there any tax benefits given to global investors? And lastly, is there any VGF policy in the Africa by government? So I'll just ask you to just go sure. Through the questions, and then you'll be the last one to speak because we'll be closing now. Unfortunately, we are running out of the allocated 1.5 hours time.
I mean, reuse is a massive issue, right? I mean, if you think about reuse or remanufacture, that's one thing if it's a capital equipment, piece of capital equipment that is outside the body, but almost everything that we make is inside the body. And I can say, I mean, I would guess that our colleagues in the medical profession would actually at least have pause around reuse for something that's going to be in the body, sitting in the body for 40, 50 years and sustaining life. I'm not saying that shouldn't happen. I'm just simply saying I think that there's a massive difference between both, between the two of them. I think best to focus this question on the big capital equipment manufacturers like GE, Philips. The people that you're working with, Dr. Mwala, probably are the better people to do with. It's not to say we don't do that, but that's not our main thing. But I want to make that differentiation. Payment risk being mitigated. Look, I mean, I'm a huge fan of the international institutions, generally speaking, or some way of putting, it could be via political risk insurance, say by MIGA, or it could be African Development Bank, or the equivalent agencies, or you could have something like the IFC as a minor investor in some of these a particular deal. Because at the end of the day, we don't want the government. The government doesn't want us to change the terms, but we also don't want the government to change the terms. So if the government has given us price and volume guarantees, and then tomorrow they decide, oh, we're going to do price regulation over that particular, which actually violates that PPP agreement, we want there to be recourse so that the deals of whatever the deal was, that we don't want that to change. And that's not specific to Africa by any stretch. Those are just some generic points. I don't know if I can provide a lot of insight on the others. Audrey, maybe my other colleagues here want to comment further on those, but I'll punt to them. Yep.
Well, thank you very much. I will not be able to extend time to more questions because we've gone more than the 1.5 hours that we should have done. So I think all I will say is that I will give just 30 seconds to each presenter to just say the last words that they would like to have on the session. And I will start with you, and then we'll go to the other two presenters. So over to you again, your last words as we are closing.
Dr. Tina, do you want to lead?
Or maybe let's start with Dr. Tinuola.
Thank you for that, Audrey. So in conclusion, I mean, I'd just like to say that in Africa, I think we have quite a lot of problems that are viciously intertwined. We have poverty, we have unemployment, and we have poor health. PPPs provide an option where we can bring in the private sector, but we must have the African governments take the lead on pushing this forward and making sure that it's systematically and done with the long term in mind. Thank you.
Thank you very much. Trevor?
Yeah, thank you. Look, I mean, Medtronic is incredibly dedicated to Africa. We're very young in Africa, and we're learning every day at the feet of our African brothers and sisters. And we're very concerned about healthcare access issues. We do think PPPs, although they're extremely difficult to negotiate, are an absolute route, if properly negotiated from both sides, to lessen some of the access issues some of us have pointed out today. Thank you for the opportunity to be with you all. Mm-hmm.
Thank you very much. Dr. Ola?
So I'd like to remind everybody about my theory that investment in healthcare can solve all of Africa's problems. So I don't want to frame this as a healthcare access problem. I want to frame this as, for all the people in Africa listening, as a solution to all of our problems. What are our problems right now? We have security problems. We have poor economic growth. We have unemployment. We have people that, are feeling quite hopeless in terms of young people that are feeling quite hopeless in terms of their future. The biggest employer in the world is healthcare. The biggest employer in every single state in America is healthcare. The biggest employer in the world is a healthcare organization. And if we can invest in healthcare, then we can employ more people, we can educate more people. People won't be roaming around doing Boko Haram and all of this terrorism anymore because they will actually have a source of income that is viable. So it's not just a solution for health access, it's a solution for economic empowerment, it's a solution for unemployment, and it's also for Nigeria, a solution for security. And that makes everybody better. A richer global economy makes the world better. So investing in the healthcare is not about just healthcare access. It's about creating a better world for Africans, Africa, and the rest of the world as well. Thank you.
Thank you very much. What a way to end. Investing in healthcare is not just solving healthcare problems, but it is also solving all other problems that come as a result of challenges of employment and other economic problems. So it's really an interesting way to end this. And we are concluding by saying that we believe that Africa though it has got a lot of challenges, the healthcare burden is, the health disease burden is high. There is a solution that can come from public-private partnership, because we realize that there is no way governments can handle it. It is not just a problem here, it's just that it's worse here in Africa. But we believe that public-private partnerships are a way. But in order for that to work, there is need for specific skills for healthcare PPPs. Yes, we do have PPPs. We do have the legal and regulatory frameworks for PPPs. We don't have some skills for PPPs, but then do we have skills for healthcare PPPs? I think that's a big question that we have to look at in order to accelerate access of healthcare in Africa and allow the problems of Africa to be solved beyond the healthcare problem. I would like to applaud the PPP Health4All for this initiative to put up this webinar, because it's not just about the webinar, but it's also about the platform that the institution is creating to allow different health practitioners to come on the table and resolve economic problems. It may look like it's a health platform to solve health problems, but we are essentially solving economic problems through this platform. So we are very happy with the intervention that's coming from PPP Health4All, and thank you all for the presentations that you've made, and the participants that are here listening and sending their questions. We would like to thank you so much, and apologies that we were not able to take all the questions, but I believe that when we make a call again for another webinar, you'll be there and we'll be able to look at what we were not able to respond. I would like to also encourage you to contact Diane at PPP Health4All to create an opportunity that you can also access more information of what you could have been looking for and you were not able to get it here. You also encouraged to register and become a member, because through that you'll be able to access a lot of all this information with regard to the PPP health sector. Thank you very much for being here. May you all have a good day or evening, and I look forward to seeing you all. Thank you so much in the next webinar that we're going to have. Thank you so much. Goodbye.